And I want to thank everybody for coming. My name is Claudia Clifford. I'm with AARP Montana, and welcome to the 2016 Legislative Health Votes Forum. So your sponsors tonight for this forum are AARP Montana, Missoula Aging Services, Montana Primary Care Association, and the American Cancer Society Cancer Action Now, that is also based here in Missoula. I want to thank everyone for coming. And just so you know, we are all nonpartisan organizations. We don't endorse candidates and we don't give funding to candidates, but we do encourage candidates to learn about these important healthcare issues, and we're really grateful tonight for all of you to show up this evening, and I hope you find it interesting to go through some of these issues that you'll see at the legislature. Your moderator this evening is William Marcus. Take a second to put on some glasses here. William, as you know, retired last year after 40 years at Montana Public Radio and Montana PBS as a host of the popular Montana PBS travelogue series Backroads of Montana. Marcus introduces public television viewers to interesting people and places across the state. He is the executive producer of the upcoming documentary on Charlie Russell, scheduled for broadcast on Montana PBS next year, and he hosts Morning Classic on Montana Public Radio occasionally, and we're really grateful for him being our moderator tonight. And I'm going to just turn it over to him. So thank you again. And when this forum's over, feel free, as the audience, to talk to some of these candidates. We have plenty of materials on these tables about the very issues that you're going to hear about tonight. Thank you.
Thank you and welcome to this forum. I'd like to welcome the candidates for coming to the table to talk about these issues. Thank you to the audience for coming. There'll be an opportunity for audience questions as we work our way through this. A couple of points at the beginning. Since there are so many panelists and so many questions, so many important ideas, if you hear an idea that you agree with, don't restate it, just say, I agree with that, maybe add a little something, but if everybody is saying the same thing, that defeats the purpose here of trying to get a lot of information out. Also, an issue on decorum. This is a forum, it is not a debate, and you are here to give your position on an issue, not here to attack the position of your opponent. And I will play ref if I have to on that. The official rules are that the candidates will sit with the other candidates running in the same Senate or House district. We will rotate the first questions based on the district and the party. For instance, the first questions will all be answered by Democrats first and then Republicans, the second question by Republicans and then Democrats, and we'll go through these districts, so you have to pay attention as I call out who's going to answer the first question. On the first question, all candidates will have 90 seconds to both introduce yourself and answer the question. We have a timekeeper in the front here who will cut off anyone who goes over that time allowed, or they'll tell me to cut you off. Each candidate will then have a maximum of 90 seconds to answer the subsequent questions. The questions here were selected by the sponsoring partners of the forum. The candidates were given a summary of the topics to be discussed today. This process will go on until there are about 20 minutes left, and then we'll take questions from the audience. Your question cannot be directed at one candidate. It must be asked of the entire group of participating candidates so that all have equal opportunity to respond. And following the forum, if candidates want to stay and answer questions of individual voters, they are welcome to do so. So, let's get started. The first question will be asked to and answered by Dick Barrett. Increasing healthcare costs impacts the bottom line of individuals, employers, communities, and the state. Preventing and targeting disease can contribute to bending that curve. Tobacco use remains the leading cause of preventable death in the United States. It causes cancer and other diseases, costing millions in healthcare expenditures each year. Effective strategies in place include tobacco tax, smoke-free laws, tobacco prevention and cessation programs leading to a 40% reduction in youth use. Raising the legal sale age is another strategy aimed to reduce the number of kids and young adults who start smoking. Share your view of these strategies.
Thank you. I am Dick Barrett. I'm representing Senate District 45, and I'm running for re-election. Just a little bit of background. I was a professor of economics at the university for 37 years before I went to the legislature. On the question, I think it's obvious that behavioral changes can play a role in reducing healthcare costs and in reducing the growth of healthcare costs. But and certainly, I think that the programs that we have had in place to reduce tobacco use have been effective, because tobacco use has gone down, and that's a good thing. So I do support all of those kinds of programs. I think they have to be aimed at young people, because that's probably where the habit gets started. And I think that, and so whether or not extending the age will have, at which tobacco can be legally sold, will have a big effect or not, I don't know. But I want to end up by saying that the problem of healthcare cost increases is much bigger and much more complex than behavioral changes. In particular, I think you can see that tobacco use has gone down, but certainly healthcare costs have gone up. And so I think when we're thinking about healthcare costs, we have to think about the full range of issues that's in front of us.
Ms. Malik.
Thank you. I'm Senator Sue Malik, and I represent the northeast section of Missoula County, the Rattlesnake, a little bit down into the university area and up to Condon and out to the east border of the county. I just wanted to say that I don't know how many of you were out and about when smoking was allowed in every public place, but it certainly has been a wonderful change that we're able to go to work and go to restaurants and other public places and not have people smoking. I did support a tax increase on cigarettes when it came to the House floor. I think that was in 2011, because that really has been shown to reduce smoking. So I think that even though the statistics show that we have relatively high cigarette taxes, I think increasing those is an important way to help people not take it up in the first place. I would support raising the legal age to 21, although, you know, the people being drafted at 18 makes me a little bit nervous about that. But what I'm more concerned about right now is e-cigarettes and more people taking up smoking as a result of that.
Elliot Smith.
All right. So hi, everyone. I'm Representative Ellie Hill. I'm running for my 4th term, I can't believe that, in the Montana House of Representatives, so I'm running for re-election. I do want to say, to start out, that I have a little boy who is 2.5, and 2 years ago, when we had this forum over on Reserve Street, remember, he was 10 months old, and I know some of you babysat him at that, but now he's 2.5, and he is in the Little Fiddlers at the university, and it's his first little performance. So my husband is going to text me when he's up, and I'm running out the door. And I want you all to know that I came because I care so much about healthcare issues, but I'm gonna leave to see him play the fiddle. So again, I'm Representative Ellie Hill. I first ran for office 7 years ago, when I was the executive director of the Poverello Center. I got involved with food insecurity, criminal justice reform, poverty, homelessness through that, ran for office. Of course, I'm here now. I'm an attorney with a little office in downtown Missoula, where my husband compares me to Doc Olson on Little House on the Prairie, because I take every client and get paid in chickens often. Last session, I was the minority chair of House Human Services Committee with Representative Art Whittick. As you'll recall, after hundreds of people testifying in 8 hours, he tabled the Medicaid expansion bill, but we shot that bullet, and now 70,000 people in Montana have health care. And I'm supposed to stop, so.
He goes next to Bill Murray.
Oh, sorry, Bill.
Sure.
Good afternoon. My name is Bill Murray, and I live in Missoula. Have lived and moved to Montana in 1970. I'm running House District 90, which is Lewis and Clark, South Hills, and a little bit of turf behind that. Regarding the question of tobacco use, I am an ex-smoker, and I did it the hard way. First of all, my wife badgered me to death, and secondly, we had a young child born to the family, and so I used to sneak cigarettes, and then I finally quit. I did it the hard way many, many, many years ago. But I do believe that young adults are impressionable. We should do all we can to try to make sure they aren't introduced to the smoking habit, as well as other smoking habits, including marijuana. So I would certainly support any program that would continue that. Thank you.
Bryce Bennett.
Hello, everyone. My name is Bryce Bennett. I'm a state representative for House District 91, which is where you're sitting right now. Includes the Rattlesnake, downtown, and part of the University District. I am, like Representative Hill over here, running for my 4th and final term to the House. It's gone by very quickly. While I've been there, I've been a champion for our election rights, making sure that everybody gets a chance to vote and there's not new roadblocks that are put there, making sure that our education system was well funded and ensuring that everybody is equal under the law. Those are kind of the big things that I've been a champion of. And to specifically address this question, both my parents when I was growing up were smokers, and I think because of that, anything your parents do doesn't seem that cool, so it wasn't ever very appealing to me. So I feel very fortunate in that regard, and they both have actually quit smoking since. But we have a lot to do, and I do agree with Sue. It was great when we took smoking out of our bars and our restaurants, and I think it's very important for us to address these corporations who have really bamboozled the public and taken advantage of our young people to try to get them to start smoking, hold them accountable to the settlements that they are required to pay to our state, even though they're trying to wiggle out of it, and try to get that settlement money back where it should be, going into healthcare costs as opposed to just the general fund. So those are my thoughts.
Ms. Marks.
Hi, my name is Doreen Marks. This is my first run for office. I have a lot to learn, and I have a lot of experience. I had a business up in Cedar Lake for 35 years. When you're a part of a small community, you're involved with people. And that's why I want to go further, go to the legislature. My district is North Condon, goes down to Bonner, East Missoula, and Clinton. So the district is large, but our personality, our work ethic, and that is the same. I have had an experience in the past where my dad smoked a lot. I remember the blue cloud in the living room at night watching TV. And he, for some reason, before all this science came out, he quit. And I realized then how I stopped coughing, even as a small child. So I've always been an adamant person that said, just for my own being, no smoking. But now we have science evidence. We have the outcomes from experiments, and I think it's our responsibility to take care of our residents. And if we have the science and we have the ability to put laws forward, we need to stop this. In the last 50 years, 20 million premature deaths have been caused by tobacco products. That's a lot less than I am.
Hi, everyone. I'm Kimberly Dudick. I'm a representative for House District 94. It is the northwestern corner of Missoula County. It encompasses Frenchtown, where I grew up, and also the downtown area, or excuse me, the north side area of downtown Missoula. I am an attorney when I'm not in the legislature. Before that, though, I was a registered nurse. And when I was in nursing school, we actually dissected some cadavers. And one of them was a smoker. And that was the most interesting thing ever, to see the tar in that person's lungs. When we actually cracked the chest cavity, the lungs stuck to the chest. And it was disgusting. But if that was something that people could really see, they would understand what happens. But when you smoke, unfortunately, we don't see that all the time. Not everyone gets to dissect a cadaver and see the tar in the lungs. And what I've done in the legislature is I've tried to promote public health issues. I'm very passionate about that. I've pursued a master's in public health where I've married kind of the law and health together. And it's been really great figuring out how to further our public policies. And in looking at what we've done, taxes are great. It can stop people from spending or buying these cigarettes, but it also generates revenue for prevention. Some other things we can do, though, is try and curb the behavior, and not only can we do that through cessation and prevention programs, but also by regulating advertising. We can stop allowing the advertising to target youth if we want to try and stop youth from smoking, and I think we should explore those things more fully. So I fully support what we're doing, and we need to do everything we can to make sure our young population is healthy.
Andrew Pearson.
Thanks. Hi, good afternoon. My name is Andrew Pearson. I represent House District 96 in the state legislature. And just want to thank AARP and Missoula Aging Services for hosting this forum. It's a great question because it links one of the most pressing issues of our time, which is increasing healthcare costs, with questions of what do we do specifically about it. And when you talk about tobacco use, absolutely, you've got to go after and take every strategy you can to reduce the use of tobacco, including increasing taxes on tobacco. But it touches on an even broader issue than tobacco. It's a question of how do we tackle this question of we're all tied in together to some extent through increased healthcare costs. We have an enormous amount of individual freedom as to our own individual behaviors. But the real question, the really difficult question that we face as policymakers is how do you continue to balance the competing goals of we're all in it together, we have to deal with costs together, but we also have to maintain a situation where we have individual freedom. And to do that, we've got to have bipartisanship, and I'm sorry that my opponent Adam Hertz is not here because he's smart, eloquent, and we disagree on just about everything. So it really adds a lot of flavor to the discussion, but well, I'm glad to see we've got a bipartisan panel here and look forward to the discussion.
Hello, and thank you for coming out here tonight. I know a lot of you guys are pretty busy, but it's appreciated. Having people active in such fields and matters is really important throughout the community. My name is Michael Ellsworth. I'm a combat veteran and a small business owner running in House District 98. I know exactly what it takes to protect your freedoms and liberties while also promoting a sound based future for future generations to come and economics and everything. And these are really big tied into economic policies in itself, and I'm really good with that. What I really see as a legislature, though, rather than coming out with several more regulations prohibiting business activities and manufacturing products and byproducts of variety, including tobacco products, but more so actually change the laws and limit it so then age in society can kind of merge together. Having age limit laws, same as alcohol, is more effective than coming out with thousands of regulations which people in themselves cannot comprehensively apply, let alone enforce by the police officers. But then to merge everything and allow each city to come up with their own policy, just like they did with having reduced smoking, we could see better changes to take place. So thank you for your time coming out tonight.
Marilyn Ryan.
Hi, I'm Marilyn Ryan. I'm running in House District 99, which is on the south side of Missoula. This is my first time running for office. I'm a retired teacher. As a retired teacher, of course, I'm going to mention education first. I taught in middle school and high school, and I saw the programs. The kids would see the pictures of the lungs, and all kinds of inventive things were in school to help kids move away from cigarettes. And yet we all know they still start smoking. So it's disturbing. When I prepared for these questions on Sunday, I was convinced raise the age. And I still think it's worth looking at and talking about and working with it. But two things happened to me this week. The first was on Monday, I went to a house knocking on the doors, and two young women were sitting on the doorstep. They had quite a bit of makeup on, and at first I thought, are they old enough to vote or what? well, as it turned out, they were 16, and mother was inside and insisted if they were going to smoke, it was going to be outside. So two 16-year-olds sitting on the step, knowing that they had the education. They went to the school I used to teach in. Second thing happened to me, and that was I went to Wardens this morning and had a lively discussion with the coffee groups. Basically, the only way, that consensus of that group was raise the price. Put that other dollar on, raise the price, make it miserable for them. One person wanted to get rid of insurance, but I won't go that far. Thank you.
Thank you all for coming. My name is Andrea Olson. I represent the heart of Missoula, which is essentially all of Missoula, but I represent Higgins to Reserve approximately and 3rd to South. I am one of those folks who experimented with cigarettes when I was in 6th grade and luckily quit. Many people do not quit. So I do think and thank all of those folks who did the coordinated campaign to address the issue of smoking, which is a public health hazard. At this point, it continues to be one, and the coordinated campaign that was run to address legislation, education, to actually provide medical assistance in ending smoking, all those things have helped, and I think we should continue all those. I think we should continue with taxes, and I do think it's a good thing to raise taxes because people don't have money to pay for something that's not good for them. But I think it's also about what we allow in cigarettes. I mean, if we didn't allow cigarettes to put poison inside with the tobacco, cigarettes wouldn't be as dangerous. In addition, when you look in places, if you go to any airport, you see cigarettes from around the world, and they have on their package no pictures of anything. They have a big sign that says, smoking causes infertility, smoking causes premature aging, and smoking kills. So I'm all for education as well in that way.
Thank you. That concludes the first question. The second question will be answered first by a Republican from each district. And by my rotation, that's Mr. Murray. So we can get the microphone back up. Right. Mr. Murray.
Need the mic.
And here's the question. Most Montanans want to stay in their homes and communities as they age, even when health challenges occur. People who qualify for Medicaid are entitled to nursing home care, but the Medicaid program that provides care in a home or in an assisted living residence is limited and has a long waiting list. Given the high cost of nursing home care and the lower average costs of care in homes or assisted living, how will you expand seniors' opportunity for services in their homes and communities? Mr. Murray.
Okay, I think this is a two-part question. So first of all, Medicare does support in-home care. And I can tell you, last year I lost 3 dear friends and my mother. All were elderly. And it's a statistic that I wasn't aware of, but only 5% of people who pass from a nursing home or some assisted care living. So the majority of people that are passing do pass with some sort of family member or in a home. As far as Medicaid is concerned, I must say, raising a benefit for Medicaid will cost everybody more money. The one thing I can tell you is that private insurance does not pay, in most cases, for a nursing home or at-home care. Now, I may be wrong. Some insurance may. So I would be very wary about expanding a benefit on Medicaid, but I would encourage more education on care of folks that are sick and dying in home. It is a marvelous thing to be able to do. I can speak personally about that. Thank you.
Thank you. So my fiddle time is upon us, and so I want to say this. Regarding the last question, I don't want to sound like a partisan hack, but I will because I'm leaving. The last question was about effective strategies for youth and tobacco. This comes up in the legislature every session, as did last session a bill sponsored by a representative and a state trooper out of Kalispell, a Republican, to require seatbelts in the back seat. It's proven now that it would save thousands of lives, particularly children. And you want to know why those bills die? On partisan votes. So I'm just going to be straight about it. There's 3 parties in the Montana legislature. There's 2 Republican parties, just like at the national level. The same with this question. This question is about pass or fail on votes. I was the vice chair of Human Services. This meant funding for senior lawn care workers, for funding for child and family services. The number of dependent and neglect cases we have in children in foster care is astounding. I've had a case open since August for a 5-year-old child who's had 6 different CFS workers. I'm leaving, so I'm just going to take a couple more seconds. Funding for the developmentally disabled, funding for mental health and addiction. It passes or fails on partisan votes. We had to blast healthcare reform, Medicaid expansion that saves lives. 70,000 people have healthcare now in Montana. A Republican sponsored the bill. But it took every single Democrat to vote for it and just a handful of Republicans that we call common sense, Main Street Republicans. They're out there, but they're not in Missoula. And I'll be frank about it. It matters, your vote matters. My husband was diagnosed last session with stage 3 testicular cancer. He started chemotherapy during the session. A man of his age, without health care insurance, would have died in 4 years. My husband is still alive. A Native American man, they will die 17 years before a white man with no health care coverage. This all matters, so your vote matters, and thank you for having me. I'm going to go watch Fiddle.
Thank you for your participation today. Grace Bennett.
That's a hard act to follow. No, on the question, I think as much as possible we should be trying to meet people where they are, and I think that we did a good job with that last session with passing a lot of mental health upgrades where we were able to provide community services where people are able to go to your home and support you in your community, so you don't have to go to the state hospital. You can go to something local and people can come to you. You know, ideally I would like to see us fund more home care workers to support not just folks who are elderly, but people with disabilities or people that have special needs. I think it's really critical, and I would say that in addition to that, you know, we've been in a long time fight to try to find some more funding for our home care workers, and you know, there's been an exciting campaign called the Fight for 15, which I strongly support. I think that the folks who are in the trenches, who are taking care of people with some severe needs, really need to be making a living wage, and I think that we'll get more people interested in that work if we can get them paid a living wage. So that's where I'm at.
These comments are why I'm excited to go to Helena. We have a group of people here that are for the people. There are investments that we make in life that improve our quality of life. There's not one single person in this room that is going to be untouched by health care issues or aging issues. Not one person. We need to take care of those that are getting older. We're getting older. It seems to me, and I have a parent that I'm trying to keep at home right now, she doesn't have the insurance. It seems to me that if she wants to stay home surrounded by those mementos of love and a life, and if she wants to stay home and be taken care of with dignity and not be put in a sterile situation, if that's her choice, and that choice is of less cost to the healthcare system, what are we talking about? It seems that being able to stay home, have dignity, have good care, surrounded by family, and it helps that patient, and it's less cost, it's a no-brainer.
Thank you. I think that this is something we really need to look at in our state because we have a great majority of people who are aging in our state. We need to look at the rural nature of our state. It is a lot easier to get health care needs when you're elderly in Missoula than it is way out in a rural place where there isn't a hospital or 2 hospitals or home care workers who can come to you. And I think that what we've heard is that there's good investments that can be made in providing home health care, but we need to do more. We need to figure out how to incentivize that growing market in our state and make it worthwhile to develop businesses that actually go into people's homes and help them stay there. And if we can't get the private businesses to do it, then rather than having our citizens bear that burden or having to sell all their stuff, then our state needs to step in and figure out the best way to provide care for those people to stay in their homes. It costs less, it's better for them, and it's what people want. So if that's all the factors for it, then we should definitely be working on that.
Andrew Pearson.
Thanks. I want to share a statistic that I learned right before this forum, which was stunning to me. By 2025, Montana will be 5th in the nation per capita oldest state. So this is a huge issue for our state. We've got to get our arms around it. So, you know, part of what the question, you know, to deal with the question appropriately, you have to consider part of the problem is this fee-for-service model where so much of, you know, so the governor announced this week actually a new initiative in Missoula, a grant by Center for Medicare and Medicaid in Missoula to shift away from the fee-for-service model and go towards focusing on patient outcomes. And that's just this huge cultural, structural shift in the healthcare system. And if they can crack the code, I'm sure that remaining at home will be part of that. You know, because outcomes certainly, you can imagine, will be better when somebody's surrounded by loved ones at home. So it's a big deal. It's a big shift. You know, if you've read the book Being Mortal by Atul Gawande, he talks a lot about this this strange phenomenon in American healthcare where, despite the general aging of the population, there are fewer medical students that are studying geriatrics, and a lot of times we focus on a specific problem and then neglect the whole patient. And I think the medical community gets it, and they're working on fixing it, and the policymakers have to be right there behind them, making sure the money's backing up these changes.
Thank you very much. There's some good conversations have been going on tonight. I'll tell you, it's fun, too, going and hearing everything. I agree we need to be expanding Medicaid. I am a Republican. Home assisted living and senior assisted living for the housing as well as healthcare is going to be huge in the long term. I think this could be a good thing for the community in developing local neighborhood plans so that we can have captive insurance policies, even leading up to scholarship and medical programs for future kids. What I see is a lot of good ideas, but not very many people, and it's very end run when you put a bill through to have meet like all the appropriations limits, having sound fiscal responsibility and plans for communities to follow, like investment strategies, implementation plans. Allowing the neighborhood councils, who are local governing bodies, to be having these preemptive and auxiliary rights can get the foot in the door and start carrying out some of the big long-term goals that we want without having to go into tremendous debt, allowing free trade principles to take place between public service providers. Coming across bipartisan is a big thing, but these are Montanan issues. Everyone ages, everyone gets old, and everyone needs the help sooner or later. But coming out with conservative fiscal plans and smart policies is the means to do so. So thank you.
Thank you. Marilyn Ryan.
I look at this issue in two ways. One, I believe we have a responsibility to take care of one another. Some people have families and can do that, and other people do not. So it's our responsibility as a state to take care of people. Secondly, it's an economic issue. It is much cheaper, as Kim already mentioned and others mentioned, to take care of people in their home, if they have home health service, if they can get people to come in and keep them there. Unfortunately, my mother wasn't one of those. We had to put her in assisted living when she became so bad. The other issue about home health care is salary. Talking to people who service in the home, the turnover is tremendous because people do not earn enough money to do the job they have to do. So salary is important. The state has a responsibility, I believe, to get the money, to have the money available and to pay workers a decent living so they will help take care of our most vulnerable people.
Thank you, and thank you, Marilyn. I agree. I won't repeat much of what you said, but I would like to say I do agree that it is healthier to treat people often in their own homes. When people are ill, leaving the home to get health care, I think, is not only more expensive, but actually very traumatic for many people. I think we keep when I've talked to a lot of medical providers, it seems to me that their increase of costs have all come from not the provision of medical services to their patients, but to increased paperwork because of all of the different systems by which people have to evaluate who pays and how much. And we've all experienced medical billing. It is not just confusing to us as patients, but it's very confusing to the medical system as a whole, and is the reason why we've had a 30% increase in the cost is because of the billing procedures. So I would encourage us to really start looking at providing the direct service of healthcare to people and figure out a way to really streamline this billing system as one of the solutions, because I do think, as many have said here, healthcare touches everybody, and it's only going to touch people more as we move forward, and those of us that are aging.
Dick Barrett.
Thank you. William has asked that we not repeat what just registered a yeah, I'm with that. So I am largely in agreement with what everybody here has said. I think we do need to expand the Medicaid program for care in the home. I do, however, do not want to miss the opportunity to second what Marilyn and Bryce said. We have an absolutely miserable record when it comes to reimbursement rates. We have absolutely failed. In the time that I've been in the legislature, reimbursement rates for home health care providers and other kinds of folks rendering social services have just been terrible, and we've neglected them, and we have to make a change in that. The only other element that I'll introduce here that I think is important, and we're going to have another question that touches on this briefly, but that is lots of care is provided by family members. And it's a hard, stressful, difficult job for those folks to provide that care. And I think we need to have support for respite care. And there are a number of bills coming out that are going to address that. In the case of Alzheimer's, I think they need to be more expansive than that.
Thank you. I would support an increase both in Medicaid and Medicare coverage for in-home care. My parents are in an independent living center in Idaho now because I have a brother over there who's a doctor, but they ran out of money a couple years ago, and so they're living on Social Security. I have to give a shout out to Montana because we have 2 credits for elderly people. One is the elderly homeowner renter tax credit, and another is the caregiver tax credit. So both of those for people 65 and older can make a big difference, and in my own parents' case would probably mean about $9,000 a year to them, which would be huge. But my dad, was trying to help Mom walk and fell and broke his collarbone, and then he ends up in the hospital and then the nursing home, and then she falls and breaks a bone in her lower back, and she's in the hospital, and then she's in the nursing home. And the nursing home is really disheartening. You could just see that Mom would be gone in 6 months if she had to stay there. So I'm very grateful for the work my dad does. And we do have somebody coming in and exercising Mom every day, so that home health care is essential.
You can keep that microphone.
Okay.
The next question will be answered first by a Democrat. This is becoming less relevant as we go along here, but I do want to at least go back and forth between the parties as we ask these questions and give the first opportunity to each party. This is the third question. My version is a lot longer than the one up there. Focusing exclusively on treating a patient's disease can result in failure to address the full spectrum of issues that arise as part of a serious illness diagnosis, like cancer diagnosis and treatment. These issues include emotional distress and physical symptoms such as pain, fatigue, and nausea. Fatigue, for example, is one of the leading reasons for cancer patients to skip follow-up medical appointments, and patients suffering from side effects find it much harder to return to the workforce or engage in family activities. Often patients don't know to ask nor have access to these palliative care services. In the next session, the American Cancer Society Cancer Action Network will ask the legislature to pass the legislation that would establish a multidisciplinary palliative care advisory council that will make recommendations on how we can increase access to palliative care here in Montana. The legislation would also empower the State Department of Health to provide palliative care information through their website and through other channels for medical professionals, patients, families, caregivers, and the general public. Given there are similar laws in 13 other states, will you vote for this act?
Yes, I would. And I have to say that I think it's really important for citizens to participate more in these kinds of decisions. And I know Oregon has had that real active program in all kinds of different areas in recent years, and I think that'll really help in Montana put some pressure on the legislature to do some proactive things. But I also wanted to give a quick shout out to Western Montana Clinic, which we just attended a couple days ago, an announcement that they received a 5-year demonstration grant to facilitate doctors working with teams of healthcare professionals with patients who are experiencing complex health challenges. So for instance, as a physician, they said, you know, I would prescribe an opioid and I would be able to assign a social worker to that case so we can follow up. Similarly, I think that might be a part of what they were doing at Western Montana Clinic under this grant. And the goal is to show that they're reducing healthcare costs as a result of this very kind of activity. I also wanted to quickly point out that the doctors were talking about Medicaid expansion and praised the governor for his bipartisan work to get that passed last session and the ability they now have to treat people they couldn't treat before who have complex problems, and now they have insurance, and they were really happy about that.
Bill Murray.
Yes, Bill Murray again, Republican HD 90. So him. You know, a few of my relatives and close family members have had a very bout with cancer. Two passed on, and one has survived. Now, I must say, regarding diagnosing lifestyle, helping out with a patient, I think the primary guy should be the first one to be looking at that. As far as a palliative committee, I don't think I'd be against that concept. I'm always about how are we going to take care of our budget. We have to be looking at how we're going to pay for this. I think it could be paid through savings, perhaps, and reducing some of the things that happen with people. So if someone comes in overweight, you know, me, you can talk to them about other things, maybe diabetes, maybe other types of diseases that could be affecting their health, and maybe help them change their lifestyle. So I'm kind of a mixed bag on support. I think I support the concept. I want to make sure that we can pay for it. Thank you.
Yeah, absolutely. I would support this council. I think it's about as common sense as anything could be, and you know, but there's a lot of things that are common sense that die at the legislature. So I don't see that there would be any problem in getting this passed. But you know, I guess I'll add to what Bill was saying. You know, there's usually not a whole lot of cost associated with these councils. Almost all of them are volunteer only, and people show up because they care about the issue that's in front of them. Even for the folks that don't, we generally find ourselves giving them a very small stipend for their time being there. So it's well worth the time and worth the effort for getting it done. The thing I'll add in looking at this proposal is that, you know, it seems like our outcomes are advice and information, and I hope that we would provide this committee with a little bit more teeth to actually suggest some legislative changes that could make a real difference in people's lives so we can get this to be a reality sooner rather than later.
Thank you. I of course, would vote for this. I see this somewhat in parallel of what the governor announced this week, and that would be the Comprehensive Primary Care Plus initiative. That plan has 3 legs to the stool, and at the very end, there's a cost savings, and that's what we're after. That's what everybody up here at the table is after, but there's ways to do it, and one of them is to really try to reach those health care outcomes that are positive for the patient. We've always wanted to do that, and how do we do that? One of the ways that's suggested in this plan is to have initiatives for the doctor. The doctor needs to perhaps gather teams, a holistic approach, maybe alternative therapies that he does not do in his scope of work right now. So that would expand the doctor's opportunity to have a better healthcare outcome. And along with that, the doctor, through this plan, even though there will be healthcare savings, he would be able to receive a token of initiative for his work. So you get outcome-based planning here, and that's what we're all after. It's a new model, but it's certainly encouraging. Thank you.
Thank you. I love multidisciplinary teams. I've been part of a lot of them. I've started some of them. I think they're the greatest thing ever because we don't know all the answers, and we only have so much experience. And bringing in people not in the legislature to work on a multidisciplinary team, to bring in their own expertise is, I really think, a great way to find a real Montana solution to our unique problems. So I definitely support the Palliative Care Advisory Council and think it could make some really good recommendations for our state. I also like the idea of providing more information to people so they know what questions to ask. It's hard to ask the right questions if you don't even know questions are out there. So I think it's really important to allow more access to that information. The Department of Health should be the one providing it. They're supposed to provide for the public's health. So they do that through information. Social media and the internet is a great way to do that, and they should be doing that more. I think, though, more so than just the website, not everyone, especially older people, necessarily go and surf the web all the time. So I think there needs to be other ways to get that information out there to people. One other thing that I'd like to say is to shift this a few years before. I'd like to see us start focusing on childhood health. There is strong evidence anymore that adverse childhood experiences, including child abuse, having alcoholic parents, contribute to long-term health problems when people are older, including circulatory problems, respiratory problems. And if we really want to get a handle on the elderly's health, we should look at getting a handle on children's health and well-being first.
Andrew Pearson.
Yeah, I think the Council on Palliative Care is a great idea. And on a related note, my wife Ivy is here, and she's studying to get her PhD in psychology, so she keeps me up to date on what they're teaching there at the University of Montana in that field. And what's really exciting is what you're seeing is a big move towards integrating mental health care with primary care and teams of psychologists working with doctors and interfacing with the patient, so that if you're not just treating the problem that the patient's coming in for specifically, but you're looking at the whole person. You're trying to get a picture of the whole situation of what's going on, so that if a medication is causing side effects, or if the reason whatever the problem is occurring is some behavioral problem, or if there are other things that just didn't even come up before the doctor, a lot of times the mental health provider can catch that because there's more socialization and more interface, and that's going to be the key to making sure that we're taking care of the whole person and not just kind of treating the specific problem that's presented to the doctor.
Michael Nelson.
Yeah, I think right here in Missoula, we live in a very unique place, time, and opportunity. Just like what Andrew was saying, we have the university system with Medicare, like facility units, and the hospitals really all merged together to give out like a diverse means of healthcare and provisions. I believe that in order to facilitate something, on a good grand scale for which other cities and localities can kind of copy and mirror image from there, is by allowing interlocal agreements to be established in between, the cities and neighborhood districts, rather than always diverting to a statewide advisory board, especially a disciplinary board they have a tendency over 2 or 3 years to be enacted to really just be a barrier to entry or access to any aspects when it comes to compromise or creating new policy. So rather than that, just adhere, let's allow the localities to have, based upon their own vested rights, the ability to, customize and modernize as they need. And here in Missoula, we have the unique opportunity to do so. We just got to work together and do it bipartisan in the long term. And just a final note, like a lot of friends that I have in the legislature, they always say, trust between senators is important. To have new bills introduced and to be passed upon is key between having trust between the legislatures themselves. So thank you.
Marilyn Ryan.
As already been mentioned, the comprehensive primary care model it will be tried in the state, and I think it's important. I certainly believe in the principle of care that includes not only the cancer, but the full person, their family, their fears, all the things people face when they have a serious health problem. I do have some questions about what the council would be. Maybe I didn't do enough research, but I need to know the cost, the organization of it. I just had some questions. I think it's a good way to look at it, and it's a start. I would also mention that when hospice comes into a case, it's a full care. It's the family, it's the individual. So the model is there. It works, and it's very helpful to both the patient and the family in a transition. Thank you.
I also support comprehensive treatment and do believe as well that we have a lot of models in place for providing more comprehensive treatment so I would support a pilot project where we start implementing these in areas where we maybe haven't done it. I do think that many cancer patients are getting that, especially once you're entered into hospice. I think mental health treatment has always required it, or successful mental health treatment has required it. And so I would really like us to start looking at really having mobile teams that go to people's homes if necessary, that provide crisis intervention when there's a medical emergency, not the kind that require you to get surgery, of course, but that require attention, and to develop treatment teams with treatment plans so that people can more effectively participate in the care of their loved ones. And I do think so if this council is the first step to that, I would be supporting that. But as Bryce has mentioned, I would like to see the outcomes be more direct care. And I think there's enough information that we could support getting that as sooner than later. Thank you.
I think that the idea of the legislation is fine. I mean, who is against more information and who is against education? That's all fine. Andrew has already mentioned Atul Gawande's book, Being Mortal. If you haven't read that, read it. It is absolutely the Bible when it comes to this question of palliative care and end-of-life care. I think it's essential reading for anyone who's interested in these issues. And I think what comes out very clearly in Gawande's work is that the absence or the inadequacy of palliative care and the tendency to overtreat terminally ill people, cost is part of it, but also just the kind of mistreatment that results from excessive and persistent treatment of terminally ill people is it's apparent from reading Gawande that that's endemic in the way the healthcare system is organized. We have to. It's just another feature of the healthcare system that we have to deal with. I think that the initiative for reforming the healthcare system that has been discussed here, that Governor Bullock introduced, is a good first step in that direction. But a lot of work has to be done on this one.
Thank you. For the next question, the Republican will go first, and Mr. Ellsworth, if you will please address this question first. Question 4. The Children and Families Health and Human Services Interim Committee have prepared 4 bills for introduction in 2017 to address the needs of people with Alzheimer's and dementia and their family caregivers. Alzheimer's and dementias are some of the most expensive diseases to society and a rapidly growing health crisis. The bills will do the following: create volunteer corps of respite workers training in taking care of Alzheimer's patients so their families can take a break. Expand Medicaid services delivered to people in the home or in assisted living to better serve Alzheimer's and dementia patients who do not do well in nursing homes. Provide resources to local aging services to address the needs of dementia patients and their family caregivers, and begin work on improving our state's adult guardianship system. Will you support these bills this upcoming session?
Yeah, there's 4 specific bills that he's naming. Yes, I would support all 4. In the early stages, when bills are gone through into committee in order to finalize the draft and meet like the appropriations committee, you have the ability, even as a outside the committee, to, as a legislature, to present amendments. I think there are a couple selective few amendments, obviously, that could be refined and key-tuned, but for the most part, absolutely. Especially when we're talking exactly, what is needed, to be included in mobile healthcare units, having mentor-protege initiatives and programs for, like, in the medical university communities. And then additionally with that, having extra tax breaks and tax credits that will be supplied for families, and having the ability to create family savings plans if their kid has special needs. That's a really big one in matters of not just education but healthcare. I really do look forward to working with a lot of members here in 2017 for the state legislature, and just working together across the party. I mean, that's really key. Here in Missoula is important. Understanding culture, rather than party politics, is long-term beneficiary for everyone, even other people outside Missoula. So, thank you.
Reverend Ryan.
I believe all of the proposals that are presented to us, whether it's the volunteer corps, guardianship, more home health care, resources, local aging agencies, are all important. In my mind, I needed to prioritize them. And I selected the home health care, which I would like to see as the primary move we make, is to provide, again, salaries, which I mentioned earlier, to increase the salaries of home health care workers, and then look at the other issues as we go through. I don't know that that's what the agencies be willing to do. That's just the way I looked at it.
Andrew Olson.
Thank you. I also agree that these set of bills are a good start to trying to address the gaps in our healthcare system, especially as we see an increase in a couple of different problems. I know from seeing friends and family dealing with dementia and Alzheimer's and frankly many chronic illnesses, that it can be very interesting, definitely challenging, but mostly exhausting. And the loss of the parent or the friend doesn't stop the PTSD from having to address what it took to try to care for family and friends. I do think there are gifts that people get from that, but when we talk about, I just want to address that we can't stop by expecting such serious health care that needs really skill, patience, training, wisdom, to be done by volunteers. We all volunteer on a regular basis. Most of us in Montana volunteer regularly, but we do have to find ways to take that profit that now is going in healthcare and put it really into the workers who are doing the job of providing what frankly seems to me to be some of the most important work that is happening in people's lives.
Dick Barrett.
I think I'll just simply say yes, I'd support the bills.
I could second that, or third it, or fourth it, but I just wanted to mention the one thing, the guardianships, because we've read these horrible stories of people being appointed guardians that steal all their money, and so I'm really interested in what we can come up with that'll make that a better system in Montana.
As I look at this, I can think of my own mother who died in her home at the age of 104 last year. Mom used to say, "Hi, Bill, how are you doing?" And at the end it was, "Who's this? Is this Charles?" And it's kind of sad when you see that happening. My sister Barbara, I think, who took care of Mom the last 5 years of her life, has an angel on her shoulder, and she'll find a special place in heaven. I think, blessed are the merciful, for they shall obtain mercy. Now, we have to do this prudently. We have to watch our money, but we have to be merciful.
Yeah, I have a family, as I'm sure many people in this room do, that has struggled with Alzheimer's. We've had a lot of people, and Bill's stories sound very familiar to a lot of the stories that I had with my great-grandmother and one of my great-uncles, as you got further and further into their lives, and they wanted to connect with you, but they just didn't have the capacity to be able to find that connection anymore, and it is incredibly sad. So the concepts of these bills I certainly would support, and I would look forward to hearing more about what the interim committee has put together.
I will fifth, sixth, and whatever motion this is that's been said. I would absolutely endorse these bills. I do want to add the thought of training. Training as simply as a spouse. My dad died of Alzheimer's. My hero, my gentleman, he was not such at the end. My mother is one of those that deny. If she loved enough, she could make it better. My mother never had the training and the understanding of what was happening, and it was even harder for her. I believe that there's additional training for primary care doctors. I went through situations in which the primary care doctor did not know that an Alzheimer patient has different complications with medications and infections. And when those are untreated, because you ignore the fact of Alzheimer's, it's disastrous. So training goes across the whole scope of the caregiver, the family, the spouses, and the medical doctors. It's not simple, it's complex, and we need to cover that so it's care that's applied properly.
Thank you. So I serve on the Appropriations Committee, and that's the committee in the legislature that creates our state's budget. It's really the only thing the legislature has to do. We do a lot of other stuff, but that's the only thing we have to do. So we get to filter all of the bills that deal with money, with either tax credits, tax breaks, or that spend funds. So I always look at things through a monetary lens. So I support all of these bills, but they're all gonna have a different life in the legislature. So the one improving our state's guardianship system, that's great. Needs to be done, won't cost any money. It really has to be changing the laws. I don't know exactly what the bill says. That's my caveat. But it's really just about changing our laws to make sure that people are protected and not taken advantage of by their guardians. There are some other issues, though. If you look at the volunteer corps of respite workers, as well as providing resources to local aging services, those are great in places like Billings, Missoula, Great Falls, Bozeman, Helena. But what about like Libby or Miles City? They don't have the people who can volunteer. They don't have the local aging resources that can be pumped up with additional money. So I think looking at expanding the Medicaid services is especially important to do it fully and fairly for everyone in our state and not just focus on the large municipalities. Additionally, I'm not going to necessarily second everything that Representative Hill said about bipartisanship and looking at what kills bills, but there are many bills that die in the legislature along party lines for no other reason, and some of these will die along those lines.
Andrew first.
Oh, sorry.
Yeah, I will most likely support these bills. I have to review the details. I think they make a lot of sense. And for those of you who are not familiar with what interim committees do, You know, a lot of this quiet work that happens between sessions is so critical to laying the groundwork for real progress on really tough issues. So, you know, if you see a legislator that's traveling to or from a interim committee, thank them for their work, because it's hard work, and it's by definition bipartisan, because that's the way the committees are structured. So if a bill is advanced by an interim committee, it's got that bipartisan nature to it, and that's really, every time you see the legislature take on a really tough, complicated issue in a thoughtful way, it's because an interim committee was there in the previous, you know, couple of years working quietly on it. So.
Thank you. The next question will begin with Bryce Bennett. The World Health Organization's International Agency for Research on Cancer categorizes tanning devices in its highest cancer risk category, carcinogenic to humans. Age restriction laws that prohibit the use of indoor tanning devices for individuals under the age of 18 are effective in deterring minors from using tanning devices and help to reduce skin cancer incidence and mortality rates across the country. Do you support prohibiting minors from accessing indoor tanning devices, including tanning beds, since usage of such devices leads to a 59% increase in the risk of melanoma, the deadliest form of skin cancer, by the age of 35, and also leads to substantial increases in other forms of skin cancer by that same age?
Yeah, I would support this. In general, you know, I like to allow people to do the things that they want to do if they are in a capacity to make smart decisions for themselves. But kids aren't there yet. You know, I think for adults, if you want to jump in a tanning bed and understand your risk, then that's your choice. But for kids who don't fully understand the problems ahead of them and what they're doing to their bodies so early, you know, I never went into a tanning bed. I think that's fairly obvious looking at me. But, you know, at the age of, I think it was 16, I had a mole at the top of my ear that required 2 surgeries because it started getting a little frayed and they thought it could be cancer. So, you know, it's a scary thing for people that age to go through, and I don't want to see other people have to go through that as well. So for kids up to the age of 17 or 18, I think that makes a lot of sense.
Thank you. I too believe this totally makes sense. As an example of what Bryce said, I was one of those foolish young people that thought tanning was beautiful and changed my life. And people do not know their mortality. They do not know that someday they really will get older. And therefore, we have laws, we have protections, and we need to go forward. We need to have a strong back and protect our young people.
So I was one of those people who took into those tanning beds. I used to be a cheerleader, go Bronx, and tanning was cool. You know, we used to walk over and tan after school. We had no idea. Our parents had no idea. You know, it was like, oh, tanning's great. My mother would be like, oh, honey, let's go tanning. I'm like, cool, Mom. But then we found out all this stuff causes cancer, right? Cigarette smoking causes cancer. Excessive alcohol consumption causes various health risks, and so we regulate those based on age, and this is the same sort of thing. There is going to be pushback based on people wanting to, you know, do what they want with their children and allow them what they want, but I think it's like any other public health risk, and if there's evidence that shows it's risky, then it should be regulated. And I think that one other thing that has to happen is that parents need to be educated about this, and they need to understand the long-term consequences of what they're exposing their children to. That never occurred when I was growing up, and I don't know that it occurs now, so that's one thing that needs to be improved.
Yes, I'd support a ban. I think, you know, particularly given the social pressures on young people, you know, if you know some people are doing it and some people aren't, you know, there is pressure to participate, and so I think the evidence supports a total ban on minors from using tanning beds, so I'd support it.
Michael Ellsworth.
Well, my grandma used to say an ounce of prevention's worth a pound of cure, but she also used to stress, you know, we need to be preserving freedom of choice within here in America. This is our way of life. You can't even find the word parent, privacy, or health care in the Constitution. So, like, these matters have traditionally been reserved under the umbrella of the courts, but we do need to have new legislation, but it should be rights-based legislation. If there once restrictions to be placed on children, you're really targeting parenting rights at that point. We need to be preserving that to the parents no matter what. There are bigger priorities other than regulating tanning beds that are drastically needed. We need to be focusing on those because those are they have the biggest consequences in the shortest amount of time, to be honest. We only have about 10 years to really get health care completely corrected. After that, we're talking about generation skipping. It's like some big needs that might be coming up. So having rights-based legislation is just where it's at, rather than always having rules and restrictions and, code affixes based upon code affixes. So thank you.
Yes, I would support prohibiting minors' use of tanning. It's an economic issue as well. We all pay for it. Our insurance rates goes up. Some people don't have insurance, even though we supposedly do today, and yet it happens. So yes, I would definitely support this.
I also would support limiting children from using tanning beds, but I don't see it as a rights issue. I see it really as a product. We, as government, have an obligation to make sure that we don't put products that we know really harm people without some kind of restriction on them. We don't let uranium-laced metals come into the country, and we really shouldn't, allow tanning on children when we know that that causes cancer. The World Health Organization has also said that glycophosphate causes cancer, and I'm going to do at least a study bill, try to get a study bill passed where we can study, because this is in all of our food, and to see what is going on with that, with the World Health Organization's assertion that that also causes cancer.
When you're at the end of the line here, it's pretty hard to not say anything other than I agree. But so I definitely agree with what Andrea just said. That is what we're talking about here is selling a product or service, and it's perfectly routine when to prohibit the sale of products or services to minors that is going to be harmful to them. So I think it's fine, and I think it's something that should be done. I must say, I think these figures are stunning. Presuming that they're correct, the impact of this kind of legislation would be very, very substantial. I also agree with Marilyn Ryan, that is that when we look at these issues as a question of personal freedom, and what you often hear the argument made with respect to, say, seatbelt use or helmet use on motorcycles or tanning beds or whatever, what you often hear is, well, it's my life, it's my risk I'm taking. But I think Marilyn is exactly right. No, when you wreck your car or develop skin cancer or fall off your motorcycle, we're all affected. We all end up bearing the cost of that. And so it's reasonable for you to take some responsibility on that.
I had a friend who died of internal melanoma just last month, and my cousin has internal melanoma as well and has been going under really difficult treatment for the last 3 years. That said, I have spent the interim on the Law and Justice Interim Committee studying sexual assault, and the age of consent in Montana is 16. And I have a real difficult time with that, thinking that an adult can have sex with a 17 or 18-year-old and get a child pregnant, and that's fine. So I'm not sure that I think that we should require tanning facilities to vividly post that there's a danger involved and people should be well informed, but I'm not sure about that. I'd like to address the sexual assault issues.
Bill Murray.
There's 180 days in the legislature, or is it 180? 120? 100. Okay, there's not a lot of time, and it only happens once every 2 years. I say this is probably one of the lowest priorities. I had been going to a barber that had a tanning booth and actually decommissioned it because not enough people were using it. I think at the very, as far as I would go, make it a parental consent thing. I don't know if you want to put liabilities onto a tanning small business. I just think it's a common sense consent. I don't know how big of a problem it is, but I'd have trouble taking up time with this one. Thank you.
And Mr. Brewer, if you'll keep that mic, you'll answer the next question, please. This is the 6th question. In the 2017 legislative session, AARP, American Cancer, and other organizations will ask the legislature to pass the Caregiver Act, requiring hospitals to recognize family caregivers and involve them when a patient is being discharged. This law would make sure caregivers are notified when their loved one is being transferred or discharged back home, and give them the opportunity to receive instruction from the hospital about the medical nursing tasks they will perform when their loved ones return home. Designating a family caregiver is optional for a patient, and receiving training is optional for the caregiver. Given that the CARE Act is law in 32 other states, will you vote for this act?
Well, I would support the concept of a caregiver. I know we had that in our family. A living will is important for anyone who has a family and a will. In fact, a will is important. As far as supporting the Caregiver Act, I'm not exactly sure what is in the wording of that act. I support designating a caregiver or having one at discharge, especially in acute illnesses or any time that there's an elderly person who is pretty dependent on the parent, on the family anyway. So I support that. I'd have to really look at the wording and see what it says, as well as just to, again, look at the cost, because we have to prioritize our money. Thank you.
Bryce Bennett.
Yeah, I support the general concept of this bill. I think that it's a smart idea. As long as designating a caregiver is optional to the patient, I think that's important for me. This seems like something that should be passed. So I'll look into it more, but I like the general concept.
I agree. We've talked about caregivers and their need, and it's almost cultural in this time and day to have caregivers at home. They need to have training. They need to have notification. They need to work as part of a team if they decide to work with a patient. I'm a little bit concerned about caregivers in the future because of the demographics of our aging population. I read a figure where right now I think it was in 75, I could be wrong there, but the typical situation for one person over 64 years of age, there were 10 workers. By the year 2050, it's projected that when there is one person over the age of 64, we will only have 4 workers. Think of the impact that does to caregivers, to schools, to training, to hospitals. The problem's going to be immense, and we need to start addressing that now, and we are in transition, and we're not approaching that.
I agree with everything that's been said. As far as supporting this law, I think it's important. I think our hospitals already try to involve caregivers, but it definitely sounds like improvements can be made. And I'd like to see longer term, besides just the initial discharge summary given, I'd like to see longer term services possible. So I agree with everything. I won't repeat it. I did want to add as an interesting tidbit, Senator Malik brought up the sexual assault study. While our age may seem low in our state, in the 1880s when sexual assault laws were starting to be passed, the age of consent in Delaware was 7. And in other, yes, disgusting, huh? And in other states like Florida and Georgia, it was 10. But by the turn of like the century, 1920s or so, it's starting to get up to the age we see now, 16 to 18. So improvements can always be made in different areas, is my point. So I think that we could definitely improve what we're doing now also as far as caregiver help.
Yeah, I certainly support the concept of this idea. I'm actually surprised that there would need to be legislation to enforce it, because it would seem to make perfect sense for everybody. And, you know, just the fact that this is a potential legislative fix to a problem is an indicator of the broader problem we've been talking about all evening, which is, you know, how do we get away from this? Let's focus on the problem right in front of our face and start looking at this more holistically and getting family and friends and everybody else involved. So this is right in that trend, and I think it makes a lot of sense.
Thank you. I support this legislative enactment, as well as expanding all other opportunities within family law exemptions. I think this is paramount and long-term for families and whole neighborhoods to be working together, providing basic resources, supplies that are needed. I'd say one of the biggest things that we could also see within the training programs for family members in a multifaceted and wide, diverse range would be just like what we do with real estate salesmen and broker license. Individuals can go to nonprofit companies, you know, get all the education needed to obtain a real estate license, and then have that even transferred into university credits, but do it based upon small scale, small business, and just minimum licensing, which is like, you know, $2,500. We could do the same thing for training for healthcare in order for our family members to provide the assurances needed for the elderly or for special needs children that sometimes may be. So, thank you.
Marilyn Ryan.
Yes, I would support this act. My mother, fortunately, was a wise woman, and she filled out all the papers from power of attorney to the care she wanted in her last days. Bank accounts were taken care of. Everything was done. And I was also fortunate I had a sister who we worked as a team, and we went through this together. But you know, not everyone has that. I've seen families being torn apart by squabbling about what should happen. I know friends who take care of friends, and they are not given the rights that they need to help the person fully. So in addition to supporting this bill, I believe education for the public about what they need to do to prepare for this time of our life. We can't continue to keep it as a hidden thing. We have to be forward, we have to step up, and we all need to take care of some of the things ourselves, but sometimes that doesn't happen. So yes, I very much favor this bill.
I also favor this bill and don't have that much to add. I would like to say that it is important when caregivers are available that they be included, it seems to me, in the development of the treatment plan when someone goes home, so that doctors know what's going to happen when someone goes home. Because I do think we might all know people who went home with the patient saying, oh yeah, everything will be fine, when there's living in a situation for very many reasons, maybe there's stairs even to where the food is, that create a problem. So I would like to encourage the more holistic treatment planning model as well. And certainly, if it's required for legislation for them to be involved in the discharge plan, then I'm all for it.
I certainly think it seems reasonable that if a patient wants to designate a caregiver and wants the hospital to provide instruction about aftercare, that the hospital should do it. But I do think that there needs to be some safeguards here. One of the safeguards is you don't want, I think, caregivers being expected to do too much or to be able to do things that they are not qualified to do. And particularly if you're trying to avoid hospital costs, you may try and get out of the hospital sooner. You may try and count on the caregiver too much. So I think that's one thing that I would want to know about in this legislation. The other thing is that I think the hospitals probably should have a reasonable expectation that here they are, they're training these people. They should have a reasonable expectation that they're not liable, and liability is a big issue in healthcare, that they're not liable if the caregiver fails in some respect, fails to perform adequately or properly. So I think that those are two issues that need to be addressed in looking at legislation of this kind.
I think this is my favorite bill because of what I talked about earlier with my mom and dad. But I appreciate also that you included in it that a family caregiver is optional, so someone could decide if they want the hospital to notify a family member. But I watched my parents learn how to lock the wheelchair, do the transfer to bed, or do the transfer to the toilet, or get into the shower, and my dad had to learn all that from my mom. So all those pieces that you have to learn to do as a caregiver are really important, and we learned it in physical therapy rather than from the hospital, so that was a great benefit to us. I also hope that included in this is learning how to access home support, so people know how to get a hold of home care providers who can help them out.
Thank you. The next question, we will begin with green marks. This is question 7. In Montana, there are 17 federally qualified health centers, FQHCs, in 30-plus locations that receive federal grants to provide primary health care in medically underserved urban and rural communities. These health centers, including Partnership Health Center here in Missoula, provide medical, dental, integrated behavioral health, and in some cases pharmacy services to over 104,000 Montanans. As a community leader, are you supportive of the role that FQHCs play in the provision of health care in your community? And as an elected legislator, will you support a policy environment that supports FQHCs and their unique model of care to Montanans?
Thank you. And thank you for this question. Out of all of them, this is my favorite. Living in the Sealy Swan, we're very rural. It takes a while to get to Missoula from Sealy Lake. It's an hour. Condon, it's 30 minutes. Beyond Condon, it's longer than that. And then there's all the gravel road you travel to get to the highway. So access to medical care has always been an issue. Partner Healthcare has come into Sealy Lake. It's increased the amount of people that walk in our local community clinic. People are amazed at the care. It's not only just medical care, it's dental care, it's mental health care, it's across the board. And it's made an incredible difference to the aging community, the younger community, and it's rather solidified the independence of a very far-fetched community in this, far-lying community in this county. I cannot say enough about what this does. I would support it, I would carry it, I would triple whatever it does, because I know what it's done for our community. I know what it's done for the health of our people. It has also provided the opportunity for people at poverty level to come in where they have never, ever had health care. It's amazing. It would bring you to tears if I could tell you some of the stories. So this is one of the best things we do in Montana.
I am very supportive of these sorts of programs. I think we need to figure out how to help our rural populations like we're hearing about in Sealy Lake. And there are more of those than there are urban areas in Montana. So let's invest in the services that help those. I really echo everything that Adrien said. We need to expand these services and we need to be investing in them and just grow that. So I definitely support it. I could say it a few more times, but it's just the same. I serve on the board of St. Patrick's Hospital, and we're keenly aware, in that position, I've learned about the health needs of our population and what services are available, and I think that this is one of the best ways to invest in our communities in doing that.
Yes, I definitely support this, and it's actually an interesting question that, there is a small faction of the state legislature that would say, on some sort of principle, we are against having this federal funding go to this purpose, and it surprises you as a state legislator because you hear about these problems. People can't get the health care they need. They're underserved. They can't get it, and you've got a tight budget, and you're trying to figure out how to. And then you've got this grant that solves part of the problem, And, you know, for somebody to say no, you know, the same thing with this Medicaid expansion debate. You had all these federal dollars available to help working Montanans access health care. And, you know, fortunately, a minority of the legislature opposed it. And it makes you question, you know, it's important to have that discussion and ask. If you meet a candidate for office and you say, you're against the federal funding to provide health care to those who are underserved, all right, well, what's the underlying principle? And why aren't you opposed to federal funding for highways or federal funding for all these other things that we do? But it's only when it comes to the medically underserved community in your district. So you've got to have that discussion. And, you know, I think if you dig a little deeper, you raise other more interesting questions. But absolutely, do we need the federal grants? Yeah, definitely.
Michael Ellsworth.
Yeah, I mean, if the federal government gives or uses its own money and designates its own administrative sites for local healthcare centers, then there ain't nothing that the state or local government can do about it. And I think it's a good thing as well. It's really needed. Just taking into issuance of why we need it in the first place is alarming. I mean, right now, Missoula County is the 5th most impoverished county, and we've exceeded our population densities for the growth limits of each individual city and town, whether if they're rural or neighborhood or urban or rural neighborhood district. I think another important issue would be to address is the last 3 years, really, we saw how the medical corporate world in itself failed in just simple mergers. We saw that, how that occurred, resulting when St. Pat's could buy community medical. They didn't because it wasn't fiscally smart. And it was a smart choice, but we need to be correcting these things. And how you do that is by looking at policy. Policy in itself, as is written, even though it's matters of health care, they're really economic sanctions. So by allowing interlocal agreements, corporate trade resolutions to occur within urban and rural neighborhoods to forward local healthcare centers and do it under our own initiative, that'd be key and long term. And the same with VA centers. I mean, we still have a lot of veterans that need assistance here. We cannot forget them. So thank you.
Fairly right.
Yes, I would support this measure. I understand the rural issues that Adrian brought up, and I would certainly look at that as well as our own community. I really like the integrated care part of this. I always find it interesting that dental care isn't always considered whole health care. So I like this program a lot.
Okay, I'll try it. Yes, I would support it. Yes, I would fund it. Yes, I would actually vote to increase this kind of service if possible.
Thank you. Declare.
Well, I'm a little bit reluctant to say that I'm going to support a policy environment. I don't know exactly what that means, but I certainly support the role of these health centers in providing care for underserved and uninsured individuals and families. I think that they're one half of the solution, and the other half of the solution is one that we have addressed fairly well, I guess, with Medicaid expansion. I imagine that the role of these organizations is going to evolve to some degree because of Medicaid expansion. I think Medicaid expansion is probably going to be helpful for these centers financially, just as it is for rural hospitals as well. That's been an important element in the support for Medicaid expansion has been that the ability to it helps the financial stability of rural hospitals that is otherwise fairly seriously threatened.
I absolutely support the health centers and say hear to Andrew Pearson for his comments, because we also had a faction of legislators traveling around the state opposed to federal grants for early education, which have been shown in 44 states to reduce the incidence of child abuse and neglect. So we need federal money.
You know, in Montana, it's inch on the map, an hour in the car, right? So here we go. I think if a town like Potomac, maybe that's not a good example, but Clinton or someone like that wants a rural medical center, I think that would not be a wise decision, even if the money came from Washington. Remember, Washington money is deficit money. We're, how many, 19 trillion in debt and climbing? So we're 45%, 47% receive our balance our budget on the feds. You know, that money is not sustainable. I believe in the concept of rural health care. I think we need to begin to look at the problem and adjust our priorities. I like the centers that are there. I'd be very wary of just willy-nilly expanding because we can get it. I think we have to be careful about that.
Yes, absolutely. I support these health centers with all my heart. I've heard so many stories on the doors from people who tell me that without a place like Partnership Health, you know, they'd be dead. They wouldn't have the opportunities that they have today. So these places change lives. They make the difference for so many people in our community, and anything we can do to make sure that they stay here and stay strong is something I'll support.
Okay, it's time for audience questions. And the first person to answer will be Michael Ellsworth. So who has a question? We have a microphone here. Please wait for the mic since this is being recorded for later cable cast on MCAT. Who has a question? You all have a question. Who wants to ask theirs first?
You know what, I don't mind, it's okay.
Shall we continue with the questions from the sponsors? Okay. You're still on board.
All right, well, I'll just continue off of question 8 then, if that's okay.
Let me read it out first. For the past 2 legislative sessions, an effort to legalize raw milk sales in Montana has failed. There is ample evidence from credible sources like the Centers for Disease Control and Prevention warning about the dangers of consuming raw milk. Do you support legalizing raw milk sales? And if so, what, if any, conditions would you place on those sales?
It was a good question, and this is actually very unique here, in, not just in Montana, but here in Missoula. This is really a matter of inspection law, if we are going to regulate it. I think having, preventative measures just in food and the basic health care is good for certain industries like pharmacy products. Right now, you can file for $25 a custom farm agreement with the Montana DNRC. They'll come in, they'll inspect it. They already do that a lot for regular, ice cream, milk, and other dairy products. So just have them adopt the same policy rather than writing more, legislation, and just allow the current boards to work and function as they're designed to be, rather than always creating more bureaucracy. I think is paramount. So right now, we have a good, unique opportunity. If the local governments want to do anything extra, then by all means, they have the auxiliary power to do so. So I would just leave it as it is. Custom farm agreements, licensing already for inspection through Montana DNRC.
This is an issue I really want to find out more about, mostly because it touches me personally and several members in the family with lactose intolerance. You can't buy milk in Montana that we can drink. I mean real milk, not Lactaid and some of those. You can in Washington State, you can overseas. Now, it's been suggested to me that I try to find legal raw milk. I won't do that. I'm not going to go break the law. I'm not going to encourage something that's illegal. But I do believe we need to look at the issue. Other states are able to they don't have ultra-pasteurized milk as we do in Montana. I think we need to look at the issue, and just on a personal basis, I have an interest.
I'm somebody who may want to drink raw milk and go get it from somebody I know, but I don't actually think that it's a good idea for someone to bring it to a potluck where you don't know where it's come from. And I think this is the problem with the raw milk bill, because there is a lot of support for raw milk in Montana. And there's a lot of people who are actually producing milk, and they want to be able to sell it because they have a lot, once you have a cow with milk, you have too much milk to drink. So, so I understand this issue. However, I think that the bills have always had a significant flaw. Raw milk is dangerous, and there's no willingness to take responsibility by putting in, you know, if you're going to start selling a product where everybody else that sells a product has to have insurance and is responsible if you produce and put out a product that immediately causes serious illness and death, that your insurance company then pays for that. That is a basic business cost that everybody that does business ends up having to purchase. And I think that's what's been one of the main flaws in this bill, is that there's been no desire to take that kind of responsibility with a product that's very dangerous.
I voted against the raw milk bills in the past, and probably will continue to do so. I think we all have to acknowledge that the unregulated sale of raw milk shouldn't be allowed with no regulations whatsoever. It can be an extremely dangerous product. So if we allowed raw milk at all, it would have to be under a relatively complete and perhaps onerous set of regulations. And rather than that, I think we should just pasteurize it.
Thank you. In 2015, I was assigned to the Senate Ag Committee as a new member, and it was really interesting because I knew nothing really about ag, even though I was from Conrad and Baker in my younger years. But Taylor Brown was chairing the committee. It was getting to the end of the session, and we were trying to pass school financing, and I was getting hundreds and hundreds of letters about raw milk and how important it was to people's health. And so we worked really hard, and we came up with a compromise bill that said, okay, producers can sell raw milk on the premises as long as they post in a prominent place a warning that says this is very dangerous to pregnant women and young children and to all people. And the raw milk people said, no, we don't want that bill. So it died, and I will continue to vote against it until there's some type of really tight control on it.
Okay, so let's see. You can use a zip line, jump off a bridge with a bungee cord, and do a lot of other things in life, but you can't drink raw milk. I would say my wife, who is sitting in the audience, and her sister, who is sitting next to her, used to travel down the road in Czechoslovakia, where they lived after the war, and have to get a pail of milk from the farmer. I think raw milk, if using basic common sense and common sense type regulation in terms of liabilities, should be allowed. Thank you.
Yeah, I think I may stand out here, and I'm going to get some glares from Kim Dudek about this, but I voted for the raw milk bill last time around, and I did it primarily because I heard from so many people, specifically in my district, that that's something that they wanted in their lives, and I tend to be one of those people that, you know, if people want to make certain choices and they're not going to affect other people, you know, I like those personal liberties as much as possible. I'm not really wild about the idea of kids having it. I feel kind of similarly about this as I do about the tanning beds. If you're old enough to make that decision for yourself, I think that's kind of a different conversation. But you know, I don't know anything about the health benefits that I get many emails about. I'm sure Sue gets the same ones. But I know that it's something that people were asking to have, and I think for adults, it makes plenty of sense to me.
I believe that, for me, the word is sale. When milk is sold, it needs to be pasteurized. I have many, many friends that drink raw milk. If you have cows, then I expect that you're going to have to give out the milk, and you may not have to sell it. But to me, when the American pediatrics tell women who are overage, Bryce, do not drink raw milk. It'll cause abortion, stillbirth, misformed children, and it's not good for kids. To me, that's a big no-no. So the word that differentiates being able to drink raw milk, go find a farmer that has a cow, go get your raw milk. Do not sell it. We are governing over sold milk, and it needs to be pasteurized. We need to protect our people.
I agree with everything she just said. I adore Bryce Bennett, but we really butt heads on this one. There was strong bipartisan opposition to this bill. There were some interesting allegiances that came up, and it's not because we really agree with everybody's issues, but because this is a health hazard, just like smoking, just like tanning beds, just like alcohol. We put restrictions on that because it endangers health. And this has been shown to cause death and severe illness. Yes, maybe we'll let an adult buy it. Who's going to stop them from giving it to their child? And then let's talk about liability. I don't think that one disclaimer that's up there that says this is harmful to children is going to stop that producer from getting sued. It is a public health issue. It has been shown to kill children, to make people very ill. In West Virginia this year, where they legalized this, they went out and they drank their raw milk to celebrate. They all then got very sick. So it makes people sick. We are supposed to regulate things that get sold. We should regulate raw milk. I'm opposed to it. If you want to go drink it, great. But it can kill children, and I'm against that.
Yeah. This is a great issue because, I mean, during the legislature, there's so much, you get so frustrated over the partisanship, people just line up on issues and then special interest influence on this and that. But raw milk comes up and everything's off it is probably the issue that the Montana House of Representatives is best equipped to discuss and debate because you've got people from every walk of, farmers and ranchers and doctors and lawyers, and everybody's got an opinion on this. And so if you were there for that debate over this bill, I mean, this is what we were made to do, is to debate this bill. And it's great. I was sort of one of those that was actually really on the fence. I mean, do I join the revolution, or do I listen to the doctors that were expressing concerns? And at the end of the day, I spoke with a number of doctors that I respected that had some very serious concerns about it. And I think it's one of those issues where, because of the existence of the regulation, we've kind of moved beyond the time period. I mean, we no longer have a lot of people getting sick from raw milk because it's just not that common. But if you did away with the law, I mean, I'm open-minded on it, and we'll go into the next debate, and I'll keep an open mind. But until somebody demonstrates to me, through sound medical science that we're not going to cause a whole bunch of people to die by enacting this law, I'm going to be against it. So.
Okay, thank you. Well, I'll have milk for dinner. For our last question, I'm going to move to number 10, and I'm going to ask you to limit your responses to 45 seconds. Timers. This is question 10. There is a bill draft request to repeal the Montana Health Act, the state's Medicaid expansion. Do you favor the repeal? And if so, what do you propose, if anything, to put in its place? Kimberly Dudek.
I strongly favored the passage of the HELP Act, and I strongly oppose its repeal. It has helped 70,000 people get health care, and I don't know why we would repeal that. It may take federal dollars, which we heard some discussion about, the evils of taking federal dollars sometimes, but those dollars come out of our pockets. And if we have access to that federal money coming back to our state, it's irresponsible of us not to take it. I support helping people through the HELP Act and not taking it back.
Yeah, I would strongly oppose repealing the HELP Act. And actually, if you haven't looked at what the Montana legislature did with this bill, you should look at it because it's this great example of bipartisan cooperation where you had a Republican carrying the bill, and the negotiations happened for a pretty substantial amount of time on exactly how we were going to get a Republican-led legislature to enact this bill that was so important to tens of thousands of Montanans. And what came out of it was a truly uniquely Montana solution. It doesn't exist anywhere else in the country. There's no handouts. It's about making health care available to working Montanans, and they've got to pay for part of the benefit that they get. So it's a great solution, and I'm really proud of what we did.
Yes, I support it. I just believe that we can, further refine it by including self-help measures, especially in matters of real estate investment.
Just to clarify, do you support repealing?
No, I support it as is right now, and then just would like to expand on it from thereafter. I really believe in having neighborhood, local healthcare options that can suit, community needs, whether if you're talking about a rural neighborhood or an urban district. So then, individuals, whether if they're university students or retired income housing assistance persons, they can have the area to do it, and then the diversity, and then just to include the family law exemptions and plans and family savings plans that are necessary for tax breaks and tax credits.
I would oppose any repeal of the Medicare Expansion Act for the reasons that have already been given.
I also would oppose the repeal of the Montana Help Act, and I also agree that we have in healthcare, as we talked for the last 2 hours, a long way to go in improving our system. Not that it doesn't work, but this was certainly a big step forward, and I would certainly not support repealing it.
I would absolutely oppose repeal.
I'd absolutely oppose repeal as well. There were many tears amongst legislators when this finally passed. We worked so hard to get it done. And states that have not passed Medicaid expansion have closed hospitals, lost doctors, lost healthcare providers. It's really important to the economy of the state. I'm loving seeing action on the reservations where people are actually signing up for Obamacare or Medicaid as a result of this, because I had no idea. We all think we do so much for Native Americans, and here they didn't even have prenatal care. And if they had, knees and that needed replacement and couldn't get surgery, they had no options and had to quit their jobs. So it's doing a lot for many people.
I, for one, would support it, and I would have supported it when it came up and voted for it. I believe I support the continuance of it, and I would have voted for it the first time. I think it's one of the things that if they get the Montanan receiving Medicaid that can actually contribute, they have skin in the game. I think that's a good thing. Thank you.
How else will we heal all the people that drink the raw milk? So I'm both sides there, but no, I'm in all seriousness. Forever and ever we heard the slogan 70,000 can't wait, and that was just a number. But once we started actually meeting the people who've got health care because of this, I ran into a woman who was able to get a new pair of glasses for the first time in a decade, which meant that she could actually go back to work because she could see. And it's little things like that and real lives that have been affected by this. So, and under no circumstances would I ever support the repeal of the HELP Act.
Surprise, I would not repeal this act. I think it's very interesting because I read a figure where when over 45,000 people applied and became enrolled in this. It was a matter of 6 months, not the 4 years that was projected. So that tells you the excitement of this state when this was passed, and hallelujah.
I want to tell you how much I admire your participation today, to come down for 2 hours to talk on these really important issues to a lot of people in the state. And let's give a round of applause. Thank you as well to the sponsors. We'll hear more from them in just a moment. I would like to invite you to join me next week at Providence St. Patrick Hospital for a forum on dementia. It'll be in their meeting room between 5:30 and 7 o'clock with a neurologist, a person who does neurology research, and also a caregiver. So I will be the moderator of that panel. It's on Tuesday at 5:30 at St. Patrick's.
Great. My name is Kristen Page Nye, and I'm here on behalf of the American Cancer Society Cancer Action Network, one of the sponsors. And on behalf of our organization, the Missoula Aging Services, AARP Montana, and the Montana Primary Care Association, we really thank William Marcus, for moderating. You did a fantastic job. And the candidates, we thank you not only for being here and learning from each other and being well prepared to answer these questions, but also for taking the risk of running for office. We really appreciate that. And thanks to the audience for being here, and I hope you learned about the candidates and where they stand. If you didn't get a chance at registration, please do so and provide us with your email so we can let you know when this forum will be aired on the community access television here in Missoula, so we can get the word out so more people can learn where these candidates stand. And thank you to Missoula, Community Access TV for this opportunity to have this be available to more of the public. We have tons of food over there, and we really, really don't want to take it home. So if you can, please eat, and please take time to talk to the candidates afterward. Thank you.